Adım Yurdum Sinan Yücel.
My name is Yurdum Sinan Yücel. I come from Istanbul, dermatology diseases clinic department. I'm going to be talking about psychiatric illnesses from physical dermatology point of view. Emotional, spiritual effects play a role, and dermatology patients, the emotional disorders, mental disorders is around about 25 to 75%. And because the skin and the brain come from the same ectoderm, and the skin actually gets red, and with its shape, it's like an identity card, and it also leads to stigmatization. The psychodermatological diseases, there is not a consensus in their classification. The reason is that the psychological mechanisms are not known, and they differ from person to person. And also, in the same person, the psychopathologies show differences even in the same patient. For instance, human morphologic disorders, somatoform disorder, obsessive compulsive disorder, or else unsecretable are different disorders. Or else a patient that has acne, for instance, they can have a simple acne, or else by just playing with their lesions, they can lead to acne scoriae, or else they can lead to neurotic excoriation. And psychodermatological illnesses can be differentiated in three groups. The first group, there are dermatoses, which many factors impede. There are the most frequently seen pictures, and these patients say that their illness starts with emotional stress, and compared to other group, they are less resistant. But they believe that they can improve their psychology. That's why they don't go to a psychiatrist. The second group of patients develop secondary development illnesses like mood and compliance and anxiety disorders. And the third group, they have dermatoses because of spiritual mental disorders. They've got weird wounds, for instance, or as prostadeni, vulvodyny. They don't have any obvious things, but they are in severe pain, or as severe phobia, AIDS phobia. Even though they go to different physicians, they cannot get a diagnosis for the sexual illness that they desire. And there are some patients who think which have hallucinated diseases. They come with different insects, for instance, saying that they have this illness. Artifact dermatitis actually is an illness that the patient actually secretly harms its own skin, and vesicularis lesions, ulcers, and nodules, purpuras, lymphoderm. These are the things that we encounter in histopathology. Again, they have a different histopathology, and without blaming the patient, actually, we should send them to a psychiatrist. neurotic excoriation, and mostly they come with seizures, and they always have a tendency, these patients, to scratch themselves, and the patient accepts that the lesions are created by them. And acne excoriate is the version that is seen on the face. These patients say that they didn't even have spots on their face when they were adolescents, but now they develop spots. Prurigo nodularis, especially in the extremity extensors. These are multiple persistent severe scratching nodules. It's an idiopathic illness. Atopic, cirrhosis, hyperthyroid, gestation, lymphoma, anemia, and liver failures are seen. And lichen simplex chronicus, mostly it is localized. It is frequently seen. It leads to scratching. Until patients bleed their wounds, they scratch. This is called orgasm cutaneous. According to certain authors, lichen simplex oculos, lichen brutus, prurigo nodularis, and the nodular prurigus of the skin with hairs are the varieties. Small defects of the body dysmorphic disorders. Mostly it is seen on the face, genital area, and it is frequently seen in adolescents, and it is chronic. Psychogenic pruritus is another thing that we mostly encounter, and it is not related to physiologic dermatological disorder. Mostly before going to bed, actually the patient immediately has this attack. Itching, scratching, itching circus is what we see, and glossopenia is not an objective finding in the mucosa, but there are like objective pain, burning. It's an idiopathic disease. Mostly it is seen with old females, and prosopenia is seen with young females. So I've briefly listed the illnesses. Now in the dermatology practice, 1 out of 2 patients actually, the psychiatric disorders, how they are treated. Mostly, although they are seen frequently, the dermatologist actually tries to treat it. These patients really seldomly they receive psychiatric examination, and that's why they receive insufficient therapy. And there are economical losses also because of this. When we think of our country's practice, a psychiatry rotation is not received by these dermatologists, and psychiatry and psychodermatology information is not found in their textbooks. That's why it's difficult and a dream actually for these dermatologists to treat these illnesses. As a solution, we have to increase the number of dermatologists and psychiatrists, and we have to add psychiatry rotation in the dermatology education. Now they provide for 1 month, but maybe we have to increase this duration. And psychodermatology seminars or else trainings could be given, and we could increase the conscience about psychology and psychodermatology. About psychodermatology, there is a lack of Turkish resources. We have to compensate for that. And legally, we have to find measures in order to increase to establish a psychodermatology maybe center, an institution. These can be different precautions, measures that we can adopt, and in patients, depression, anxiety, obsessive-compulsive disorder, if we think of them with patients, we are recommended to give an SSRI. If we think of psychosis, the patient should be inwarded and a consultation should be received. As a result, dermatology practice 1 out of 2 patients need our support. Thank you very much.